Hello everyone, I'm Jacquelyn Fletcher, and you're watching Healing Words, brought to you by the Mayo Clinic Dolores Jean Lavin Center for Humanities and Medicine. Today we're going to talk about honesty and how that impacts the art of writing and healing. But before we get started, I want to let you know that this is a participatory show. We'll be sharing some writing exercises with you, so I hope you'll grab something to write on. You can ask your nurse to contact the Lavin Center for Humanities and Medicine if you need a notebook. So all right, let's get right to it. My guest today is Dr. Louise Aronson. She's an associate professor of medicine at the University of California, San Francisco, where she cares for frail older adults in the Care at Home program and directs the Northern California Geriatrics Education Center and USCF Medical Humanities. In addition to her MD degree from Harvard, Dr. Aronson also has a Master's of Fine Arts degree from Warren Wilson College. She's the author of a book of short stories called A History of the Present Illness, and many other articles. She's received the Sonora Review Prize, the New Millennium Writings Award for short fiction, and 3 Pushcart nominations. Dr. Aronson, welcome to the show.
Thank you, it's great to be here.
Well, I have to tell you, I'm thrilled to have you here because I have read now your book and many of your articles and your website. And I wanted to first just bring up something that you have on your website. It's a quote that I read there. I realized that the most important stories and the ones that made my work so meaningful and fulfilling were the ones I never heard except in my office. The stories of real people of all ages and backgrounds confronting illness, aging, and death in ways both human and heroic. Can you talk about that a little bit, why that was so important to you, those stories that you were hearing?
Well, I think that's the great joy of medicine, that you are part of people's lives at these critical junctures. And story is what makes us human. It's how we define ourselves in the world and explain ourselves and make meaning from life. And there is a lot written about medicine, and there are some wonderful, wonderful books and have been for decades and centuries. But there wasn't something that quite captured realism or the real experience in the way that I felt like I was living it with my patients or with my family or as a patient myself.
Yeah.
So I wanted to try and do that. Well,
and you succeeded, I have to say. You've got a quote too from the author Tim O'Brien at the beginning of your book of short stories, and he is, a very well-known National Book Award-winning author who writes about the Vietnam War. And I was so interested that you, so the quote is, "If you don't care for obscenity, you don't care for the truth." And I mean, I read that, it's like, oh my gosh. And in one of the stories in your book, I think it was the last story in your book, one of the characters talks about that the books about writing about war were the ones that really taught the character how to write stories about medicine. And so, I wondered how war stories help, I know this was a character talking about this, but how they relate to helping tell the truth. I mean, what do they have in common with stories about medicine and telling the truth?
Right. It's interesting you picked up on the last story, because that's the one that it's definitely fiction. The characters and events that happen to the characters are not my life. But some of the thoughts on writing and writing about medicine are clearly mine, as you can tell. It's quite a pairing at the beginning and the end about war. And I think it's because war, like illness, is one of those moments where your life is on the line, potentially, or your well-being is on the line, mentally, physically. I mean, it doesn't really matter. All those things are equally important. And so it seemed to me that in looking at how people talk about those really hard, terrifying moments where life or wholeness are challenged in war, that was a great model for medicine. The literature on war is more advanced than the literature on medicine and health, which is kind of ironic. I mean, both clearly, both illness and war have been around since we've been around as human beings. And it may also be that I felt like there was more variety in how people tackled the topic and more opportunities.
And I find that interesting too, because one of the lines that she talked about, that there's opportunities there, I want to kind of hone back in on this theme, was the honesty part.
Right.
And so the line, in other words, they were honest. I wanted to be honest too. And I find that so interesting because we started the discussion saying that these are the real stories. You wanted to write a book about realism. And one of the things, I was so struck by that it is just such, you feel like you're looking through the window into a moment of somebody's life, and you don't get to know the ending of the stories because we're just seeing this moment. And so I wondered, as a writer, did writing about medical stories, because the stories are a lot about patients and they're about doctors and the interaction of those worlds, and did the writing help you get some kind of peace or closure? Because, there's no ending to the stories.
Right. Well, I think part of that is the form. You can't necessarily do in a story what you could do in 400 pages. And part of that is that's often the experience of medicine, particularly from the provider's viewpoint. Even if you, and I do a lot of primary care geriatrics, so I know people often for years and I know their families. But I'm not seeing them all the time. I see them episodically. And I mentioned this at some point in the book also, where you sort of come in the middle of someone's life and you're with them for a period of time, and then they go and you go. And you have this really intense exchange and you care about them very deeply and their well-being. And you don't always know how it ultimately ends up. I mean, obviously in a story, the actual events of that story need to be resolved. But I wanted to give readers a little bit that experience of life. And we all have it in different contexts. I just happen to draw from the medical.
Yeah, well, I love that. And I just wondered too, as I was reading this, because you don't have, I mean, it's so real, it's so episodic and so true to the world. I mean, that's what great fiction does, right? It shows us these moments. But I also wondered, how did the process of writing these stories help you have a better understanding of your world, your inner world, your spiritual world, your world as a human being on the planet?
Right. Well, I wasn't actually going to write about medicine, but that's what I do, a lot of hours of most days. And it's also, it's this key moment in life. And so I think it helped me, and you have doctors and our medical students and nurses and others, we often talk about how you have all these intense experiences and there's no time to really process them or think about them. And I think in writing them and reformulating them, and the book is it's sort of funny because it's very realistic, but it's fiction. But it's fiction based on 20 years of real experience. Well, more than that, but that amount of time as a doctor. So it's sort of real and artifice all at the same time. And in constructing those fake realities that are meant to seem like real realities, I had to think, how do I feel about that? And what mattered about it? And what was the essence of this person? Because unless you get someone's permission, obviously you can't steal their life and tell their story. But I think it's made me a better doctor and a better person, actually. I would have said that or certainly I try to be the sort of doctor who listens, and I definitely care deeply about my patients. But I think I thought I was better understanding their perspective than I was until I tried to write their perspective and really inhabit their lives. And that sort of humility, learning that lesson was important, and also learning how to better inhabit their lives, to pause. There's a lot in medicine, which we may talk about later, about difficult patients or patients you're having trouble connecting with. And patients often get blamed for that, when obviously in every relationship it's a two-way street. And being able to think of the other person's perspective is so helpful in getting through those moments. It doesn't solve every problem by any means, but it's really helpful.
Well, I love that. I mean, that's such a wonderful description of it. And it just leads beautifully to this question I had about what you said on your website, because it says that you describe yourself as a doctor and writer, or maybe a writer and a doctor. And I find that so interesting that this really helped you, like when you said that it inhabit your patients' lives in a different way. I love that. And so would love to just, now that you've been through this experience, you've had this deepening, you know, of getting to know your patients, how are practicing medicine and practicing writing similar now to you?
Oh, that's an interesting question. Well, I think the word practice, it's interesting, the word practice is used for both. It's not a place you arrive at. It's something you constantly work at. And I think some people find that frustrating, but if I got to something, if I knew everything about it, it would be less engaging and interesting to me. And I love to grow and learn and change over time and to do that with other people. And I think both pursuits allow me to do that.
Yeah, I love that. Well, and we talk a lot on the show about actually using writing as a practice for healing, to help aid the healing process, you know. And some people do it in the room while they're here at Mayo, and some people do it later on, you know, after they have left Mayo. But there was a character in the book that I wanted to just touch on, because I want to get a little bit more around this writing medicine relationship here. And again, it's in that final story in the book. The character says, "I began to wonder what counted as meaningful work, and by extension, as a meaningful life. I didn't see that those questions linked my writing to medicine." And so I just wanted to explore that a little bit about what is it about those big questions that linked the writing to medicine in particular, and healing?
I think it's part of it is really thinking about who people are as individuals. That's also one of the reasons I don't think I knew it at the time when I was younger, but I think it's one of the key reasons that I was drawn to geriatrics, the care of older adults, because you really have to understand the person's whole life, their values, their priorities, to help determine treatment. So many of our studies are done on middle-aged people. And the same treatments may or may not have the same effect. You know, if you walk down the street and you see a 50-year-old and a 90-year-old, you know right away those are different people. And people often make that different bad, but it's actually just different. And one of the joys of geriatrics is I really have to know, you know, what do you value, who are you, how many years of life do we think you have, and how do you want to spend those years? So I think that's the writing, and those big questions are critical, and not just for older patients, for all of us as human beings, to determine what's best for us. So often in medicine we say this is the right answer or this is the right treatment, and that can't be true, because it's only what is the right answer or what is the right treatment for a particular individual. And writing gets to that particular individual beautifully. Yeah, I love that. So then what happens, because you also teach writing to healthcare providers. I do.
And there was an article that you wrote to healthcare. It was in The Lancet, which is a publication for healthcare providers.
Right.
And you wrote about that, I love this quote, "Everyone responds to stories. For millennia, stories have been a universal and universally effective mode of communication and persuasion. We are introduced to them in childhood. They transcend time, culture, and geography. We use them to derive meaning from experience and to pass along knowledge, values, and wisdom." I mean, this is how we become human beings.
Right.
And so when you're teaching people the value of writing and asking them to do writing exercises, which we do here on the show every time, and you hear objections. I'm not a writer, I don't know how to write, I've never done it. I mean, what do you say to people about getting started or the value of writing? What do you say to somebody who's like, I don't know what to do?
Well, it's great when they're medical students because we can make them do it, but but really, I think one of the things is they're thinking that they need to write in the way a writer writes. You know, there are many reasons to write, and producing a book or whatever is just one of them. When I was writing my book, I didn't know I was writing my book. I actually thought I was learning a craft that I enjoyed, that maybe my family would read, and the poor people in my writing group. And that I was helping sort of heal myself and understand what I was doing and why I was doing it and deal with various emotions so that when I was with patients, I could really be present and attentive and the best me I could be. So with students, I see writing as a way, or actually with anyone, not with students, when I do this with faculty, when I do it with patients or caregivers, it's a way of understanding your experience and engaging with it. And it doesn't have to be beautiful. And in fact, the more a person thinks like I have to write a beautiful sentence or I have to write a whole great big piece, the less likely they are to write even one word, because that would certainly shut me down in a heartbeat. So I think the thing is just to use it as a mode of expression. I also think these days we have lots of other options. Some people prefer speaking, or don't feel comfortable with the writing process, or videotaping. And those are other ways of telling stories. We have more options now than we ever have.
Yeah, it is easier, isn't it? And people, it seems like, are getting more comfortable with it because we tell it all day long with our thumbs. We tell stories.
Yes.
And so there's a story that I love that you're talking about how you use it for yourself, and then you also share some of your writing with other people. And you wrote an article in the New England Journal of Medicine, which is available online that anybody can read, but it's about good patients and difficult patients, and it's meant for the healthcare audience. But I would love it if you could just talk a little bit about what happened with your dad.
So my father had had quadruple bypass surgery and a valve repair that had not gone particularly well. There was a moment where we were waiting. It's, under the best of circumstances, it's a long surgery. And we were waiting in the waiting room, and the surgeon didn't come down and didn't come down. And my mother begins saying things like, I guess I'll sell the house. It was just horrible. Anyway, so we finally got him home after weeks of problems, and then I was helping him in the bathroom, actually, and he just didn't look right to me. So sort of cutting to the chase, we end up in the hospital, and there's something clearly wrong, and they're sort of saying he's fine, but he's clearly not fine. And his vital signs, which are called vital for a reason, keep becoming very abnormal, and they give him fluids, but they haven't diagnosed it or treated it. And I'm trying to just be the good citizen, right? We've all had this experience. You want them to like you want them to take good care of your loved one, you're behaving yourself. And then this kept happening, and I suddenly realized that if I thought of what was going on as a doctor, I actually was pretty sure I knew what was going on. And so I don't know if you want me to give it away or not, but I did an intimate exam on my father and proved, I did a rectal exam and proved that he was bleeding internally and that he was critically ill, and they had him in the intensive care unit, within minutes after that, and we actually did get a great deal of attention. But you wonder, if I hadn't been there or if I hadn't been a doctor. At this point, we hadn't really had dinner. It had been over a month of very hard times on all of us, and my parents were just kind of both leaning their heads together on the gurney, and might have fallen asleep. And if we had said, oh, well, they're sending him home, we'll go home too, he could have just died there or died in their bed.
It's a powerful story, and so why did you choose to share it? Why did you feel it was so important to share it?
Well, I didn't share it for 7 or 8 years, actually. Some of it was very intense, so I just wrote it down, and I think that's one of the things that might be helpful to people, is not to think of it as you're writing something, but that something incredible happened and you might want to remember it, or it's just incredible, or you don't even know why you're writing it down, you just write it down. So I had that, and a few years later I went back to it, and at that point I was kind of angry, and I was thinking they made a mistake and so forth. And so I wrote it. I had the initial story part, and then I wrote the part about mistakes, and I sent it out, and summarily rejected by everyone immediately. So I think, oh, well, that was a bad idea. Although, as a general rule, I would say, like, if you're still angry about something and that's coming through in the writing, it's probably not going to do very well. But I was a little younger. So then another couple of years passed, and actually in that time I was doing this other writing. And I said earlier, I do think it's made me a better person or a more generous person. And sort of another nice thing about writing and stories is you can revise them, whereas your actions you actually cannot revise. So it gives you a chance to practice thinking about, like, okay, I was angry, but what would happen if I weren't angry? What would happen if I stepped back and looked with another set of eyes? And so really thinking about it, reflecting about it, gave me this new insight into, I was angry because the doctor stood there for a couple of hours and didn't do anything. And then I began thinking, why was that? And it's the culture of medicine that really you feel like you have to behave or they're not going to like you. And if they don't like you, are they going to give you good care? And that's not really the right message, because often families and patients have the most critical information needed to make a diagnosis. We actually say in medicine that the history, so the story told by the patient and caregivers, is 70 or 80% of diagnosis. So we need to do a better job of listening to people.
70 or 80%, wow.
That's the lore. I've never seen data to that effect, but that's what's quoted.
Stories are important.
Stories matter.
Well, and you also brought something up too, which happened in this story, and it also, when you were talking earlier about the work that you do, that you really love your patients. You get to know them over time. And there's a beautiful story too, where a patient or a doctor is walking away from a patient who is dying, and just admits that she loves this patient, and that's why she had given him radiation and chemotherapy when he didn't really need it, probably. And I love that the work that your work, both your fiction and your nonfiction, show that healthcare happens between people.
Right.
And
that's why it's such a great job.
That's what
it's fabulous.
I bet. and it's beautiful, and it's messy, and it's really ugly sometimes, and
all at once.
All at once. And I would love to know, when you're doing your work, when you're doing your writing, you can, however you want to answer this question, but how do you see the beauty that's within all of the ugly, the challenge, the messy moments?
Well, I think mostly that comes fairly easy to me because I like people and I like talking to people and learning from people. So there are things that are a pain, like paperwork, or these days it's more our electronic medical record, which really is trying to kill the story in medicine, but that's a different conversation. So if I get to interact with people and have a relationship with them, people are complicated and we all have good and bad parts. Really, there's almost no one who's either a saint or completely awful. There are probably some exceptions, and certainly some of us are at various times in different places on the spectrum. But it's really the people and the stories and the relationships that bring me through that, and understanding that that's all of us, and trying to find those moments of connection. I also think that's nice when you're having trouble to really pull back and try and find common ground as human beings, or understand the person's experience, really sort of pulling back, especially when you're feeling frustrated, I think makes a difference.
Yeah.
And other times you just need to speak to other people, or maybe it's not the right match, but I would say that's rare.
Well, but I want to kind of really highlight this, what you're talking about here around connection, and that we use storytelling to connect with other human beings and to feel known and to feel, so it happens in healthcare, it happens in our relationships at home, at work.
Right.
And there was a moment that I also want to just highlight it may be the same story again. I did read the entire book, I promise you. Not
well,
just
the
this
last story
one.
does reference the whole endeavor, so that's why.
Yes. But because it was from a doctor's point of view, and I really loved that. It says, doctors you see aren't so different from patients. Every day we hope someone will see past our elaborate and very impressive window display to the jumble of expired product weighing down the shelves and choking the aisles of our psyches. I loved that moment. It was so artfully written, but it was also this beautiful moment of, that's what it's all about.
For all of us.
For all of us. Yeah, thank you for that. So our show, it's an extension of the creative writing at the bedside program here at Mayo. And so I always ask my guests to provide a writer's prompt, and I'm hoping that you will share one.
Okay, well, there's one that I've been using a lot lately with all sorts of different groups, which is tell the story you've never told. We all have stories we don't tell. So tell a story you've really never told other people. It's powerful. It takes some courage, but you've probably never told it because you're holding on to something, and sort of wrestling with that can be very interesting.
Ooh, I love that. And we can burn it when we're done, right?
Absolutely.
Or delete,
you do
delete,
not
delete,
have to
delete.
show anyone.
I love that. What a wonderful exercise. That's great.
Yeah.
Thank you.
Absolutely.
And I'd also love it if you would read a selection of your work for us.
I'd be happy to.
Thank you.
So this is one section from the middle of a short story called Becoming a Doctor, and it's about a young adult's transition from normal person to being a doctor. Walter was a cowboy and Vietnam vet with a failing heart. I took care of him on internal medicine at the Veterans Hospital, my second rotation. He was from the Wild West somewhere, a place with lots of rivers and streams. He called me honey or sugar, never doctor or doc, wore a bear-tooth necklace with his hospital gown, and taught me to start IVs. "Try again, honey," he said when I missed. "I got plenty more." I saw Walter several times a day, not only because he was so sick, but also because, even though my team had 14 other patients, being a newbie student, I'd been assigned only Walter. Also, I liked him. From Walter, I learned that moose shed their coats late each spring and for months look like mangy dogs, that the best protection against a bear is to sing at the top of your lungs, and that a single elephant turd can weigh 8 pounds or more. Elephant? I asked. Even a city girl like me knew that the only elephants in North America lived in zoos. "Read that one," Walter admitted. He also admitted that he hadn't killed the bear to get the bear-tooth necklace he wouldn't remove. "My daughter found it," he said. "Gave it to me for Christmas the year she was 6. The next week her mama packed them both up and took them back to her parents in Phoenix." "Where is she now?" I asked. "Dunno, sugar," he said. "She got poisoned against me a long way back." 10 days after his admission, on a sunny Wednesday morning when our team was doing morning rounds, Walter announced that he felt better. "Seems like maybe the old ticker isn't used up after all," he told us, sucking air through dusky lips pursed to a crenulated O. The real doctors on the team nodded and murmured, weighing the pros and cons of sending Walter home. When the senior resident gave his okay, with the usual caveats and warnings, Walter smiled. As the others filed out of the room, I squeezed Walter's hand. It felt cool and limp, like a fresh-caught fish, and I wondered whether his heart, though improved, was doing well enough to keep him going outside the hospital. I told Walter I'd be back later to do his discharge paperwork, and then I hurried off to catch up with my team. Walter winked and said, "Catch you later, sweetheart." But he didn't. When I got back to his room, a man, bright yellow from jaundice, lay sound asleep in Walter's bed. I raced to the nursing station, sure that Walter had died, but he hadn't. He'd gone home. The senior resident had done the paperwork while I was at a student conference. "Hey," said a nurse, holding out a wadded piece of tissue. "He wouldn't leave unless I promised to give you this." Inside the tissue was the bear-tooth necklace. "So creepy," said the nurse. I held up the worn leather strap. Most of the huge tooth was a yellowish-brown, lumpy and ridged, but the tip was pale and worn, with a chip at what should have been the pointed end. I tucked it into the top pocket of my white coat, safety-pinned it in place, and headed down to the emergency department to meet my next patient.
In Dr. Aronson's collection of stories, she writes about some pretty tough moments that, when looked at one way, could be considered the ugly parts of life. We see a former doctor watch a young boy fall and refuse to help him. We watch the deterioration of a man with cancer. We see a family refuse to get their elderly mother the care that she needs. Dr. Aronson has created a beautiful collection of stories by writing truthfully about the dark parts of life that we don't like to look at. By doing so, she gives us a way to express and release our own dark moments to make room for new growth. I'd like to use that idea as a jumping off place for another writing exercise that actually comes from the visual arts. Photographers are often asked to find something ugly to take a picture of and to make that object look beautiful in some way. I'd like you to think about something that you think is ugly. Then write a paragraph about that that shows some form of beauty in it. For instance, I might choose to write about a moldy strawberry. First, I'll describe the strawberry, what it looks like, what it smells like, how the mold has changed the strawberry. Then I'll think about where that strawberry came from, who planted the seed that grew it, who watered it, who brought it to the grocery store, what will happen to it after I throw it away. Will it end up in a landfill? Will it become new soil? What is the story of your ugly object? Was it always ugly? How did it become ugly? There's a wonderful anecdote about how William Faulkner wrote The Sound and the Fury. He says he was walking down the street and he saw a pair of men's underwear in a tree. He immediately began asking questions in his mind. How did those underwear get there? Who put them there? Who did they belong to? Stories are created by asking questions, answering them truthfully, and then asking more questions. During your writing experiments, if you ever get stuck, just ask another question. As you explore your world by writing about it, don't be surprised if you find the beauty in the ugly moments and the meaning in your everyday experiences. I want to thank Dr. Louise Aronson for being on the show today. Her writing, both fiction and nonfiction, gives people the opportunity to start conversations about difficult and ugly topics. And through those conversations, we connect, we learn, and we heal. And that's beautiful. You can find more of her work at louisearonson.com. That's LouiseAronson.com. If you'd like to explore writing during your stay at Mayo Clinic, you can request to have a writer visit you in your room by using the contact information on the screen. You can also watch other episodes of Healing Words here on the Humanities channel. Before we go, I'll ask you a few questions. Are you willing to try the writing exercises you heard today? Can you write for 3 minutes? Can you write for 10? Will you do it right now? I hope so, because writing can be an amazing tool that can help you make sense of the world you live in. Thank you so much for watching Healing Words, brought to you by the Dolores Jean Lavins Center for Humanities and Medicine at Mayo Clinic. I'm Jackie Fletcher. Until next time, be well.